Hello everyone, I'm Firly. I'm a student on Kusuma University, and today I wanna demonstrate how to take vital signs. First, what you wanna do is you wanna gather your supplies. You gonna need a blood pressure cuff along with a thermometer of some types and a pulse oximeter. And then what you wanna do is you wanna perform neat hand hygiene. Now, what is called studying the vital sign measure while you're the checking the patient. 1. Blood pressure. 2. Heart rate. 3. Respiration. 4. Temperature. And 5. Oxygen saturation. So, I've arrived to the patient exam room and I've performed hand hygiene. Now, what I want to do is, I wanted to introduce myself to the patient and tell them what we're gonna be doing. So, hello, my name is Firly. I'm nurse in here and now I'm doing in here, I will to checking your vital sign. It's okay with you? Yes. Okay. Then you want to do your patient identification by looking at their armband, having them tell your name and their date of birth. Next, we're gonna measure the patient oxygen status, and to do that you can use a portable probe like this one connects to a bedside monitor. And to do that you're going to place the device on the nail bed because that's where it's going to option the reading. So make sure that you pick the thumb finger that have good circulation and they're nice, warm and pink. So we will turn on our device and we will place on the finger and let it get a reading. And their patient oxygen saturation is 98%. And the normal oxygen saturation is anywhere between to 100%. And below, you can also see the next heart rate as well. But here, in a moment, we will actually check the heart rate and then you will just want to remove the device. And if it's like a portable one like this, you'll want to clean it with a disinfectant wipe and document your finding. The next, we're gonna check the patient. And the next, we're gonna check the patient pulse. And as we feel the pulse, we're gonna be looking several things. Of course, we're gonna be counting the red pad. We also going to the feeling the strength of the pulse. And the rhythmic is the pulse regular or irregular. And now in adults, the most common site to the use to check the pulse in the radial artery because it's already easy to access. And so it's fun. You wanna do is fun time and it's fun below. It's in these words are song the radical part. And whenever you're checking the pulse of the patient, you can sit up in bed and the can lie down and you want to support them arm extended out and support it. And you're gonna use first 3 fingers to feel the pulse. So use your first 3 finger and find within that arm. I just taught you, I likely just touch it. Don't press too hard and feel the binding of the pulse. And so, since heart rate is 18 to its regular, and a normal heart rate is in adults is 60 to 100 beats per minute. And now we are going to do is we are going to keep your finger here because what we want to do next to tell a patient that you're checking the patient respiration. And if you the respiration, they're gonna alter the way what they're breathing. So we're gonna stay in this some position and access respiration. And when we're assessing respiration, we're looking at a couple things. First of all, the rate, normal breathing rate in adults, 12 to 20 breaths per minute. And have found the easiest way to do this is really look at the patient from the side and what of their cone. Their clothes are the rising and fall because one rise and one fall equals one respiration. You can also sometimes just gently take your hand, put in their back and feel the rise in the fall of the chest. And so you will count that for 30 seconds if their breathing rate is irregular. And then multiply that by 2, but if it was irregular, you would need to count for 1 full minute. And then document your finder and next your finding. You would need to count for 1 full minute and then document your finding. And next, we will to check temperature patient. We will check the patient temperature of the alert. What needs to be prepared? It is a thermometer. First, place this tip on the thermometer sensor directly on the skin in the middle of the arm. Make sure is not a blocker like floating. Hold on the thermometer for 2 to 3 minutes or until it beeps. See the measure result from the thermometer. The patient body's temperature is 36 degrees Celsius and it is normal. The normal body temperature is 35 to 37.5 degrees Celsius. And lastly, what we're gonna do is we're going to measure the blood pressure. Make sure to confirm that when patient is well rested and has not had any physical activity for the last 20 minutes or so and remove any restrictive clothing. First, she asked me to sit comfortable in the chair with my back supported and my feet flat on the floor. She told me to relax, She told me to relax and stay quiet for a moment because talking or feeling stressed can sometimes cause a temporary spike in the numbers. She then rubbed a gray fabric cuff suddenly around my upper arm, just above the elbow. I felt a sudden pressure as she began inflate the cup. It felt like a thing squeezed for a few seconds, a bit uncomfortable but not painful. As the air slowly researched from the cup, I watched the cup closely. She was measuring to specific number. After a moment, the cup deflated completely, and the result is 1050 over 18. She announced that is a very healthy range. I feel a sense of relief. It's a simple and quick procedure, but it's one of the most important ways to keep track of my heart. I thanks this patient and had a feeling grateful of that I took the time for the checkup. And done for how to take care of vital sign in patient. And that's all. Thank you. See you.
I just had to let you know you're